Hello. Hi, how are you? So welcome everyone. My name is Sarah Muller-Robbins, and I am the Director of Education at the Partnership for Maternal and Child Health of Northern New Jersey. So I'm so glad to be here today to talk about Breastfeeding Month next month. So I'd like to welcome my colleague, Charlene, if you'd like to introduce yourself and your role.
Hello, everyone. My name is Charlene Santana, and I am a nurse home visitor for Nurse Family Partnership at the Partnership for Maternal Child Health of Northern New Jersey. Currently, I service Bergen and Passaic County. We are all throughout New Jersey, and we service different counties and throughout the United States. So we are a national program to assist our first-time moms.
That's great. And so you are very involved with parents who are breastfeeding, which is perfect for this conversation. On Sunday starts World Breastfeeding Week, which is August 1st to the 7th, but actually turned into a whole National Breastfeeding Month. And so when it comes to having a breastfeeding week and breastfeeding month, do you have anything to add about why we have this, why it's important?
I feel it's a very important topic to get ourselves as moms to love breastfeeding again. We need to fall in love with breastfeeding and everything it has to offer for our babies and for ourselves, for that special bonding time that we have with our little ones. It's been a long road. I think we've made a lot of progress, but there's still so much more to go. As a Latina, I feel that we've made little strides, but like I said, we still have a long ways to go. How do you feel? How has it been for you?
Yeah, I get such passion talking about it from my personal experience, as well as just working with families. I've been a nurse working with breastfeeding families for 21 years now or so, and been a lactation consultant for a number of years also. And I just love working with families during the vulnerable time of becoming a new parent and learning how to feed your baby. And so the World Breastfeeding Week every year has a different theme. And this year's theme is shared responsibility, which I love because I feel like so often becoming a new parent and trying to make sure you're feeding your baby can feel like a really isolating experience. And particularly this last year and a half of being a pandemic, even more so isolating. And I think so often we often as parents feel like if something doesn't go as we plan, like, what did I do wrong? And I did something wrong. It's my fault. But really, I love this theme of it's a shared responsibility. And so how do you feel about that theme, given the work that you do in working with families?
I think it is a wonderful one. It's the perfect name. Being as yourself, a mom that's breastfed, I was blessed with having twins, and I went in with this notion, oh, well, if my grandmother did it, my mother did it, it's going to be so easy to do it. And obviously it had its obstacles, but I was very grateful that I had that primary, secondary, and even a tertiary assistance with my husband, my mom, my sister-in-law, my brother, and a cousin who was just breastfeeding. But it made me I felt like I needed to do more because I had all that, but not everyone around me. I worked at a hospital at a time and saw the clinic, and I saw they did their best to assist, but again, the language barrier was there for a lot of the moms. And it made me start my journey in becoming a nurse, to becoming a CLC, to becoming an international childbirth educator, and now pursuing an IBCLC. How can I help my moms in their native tongue get this shared joint compassion to be able to breastfeed? And it's been a long journey. And last year, needless to say, we all went through it. I can't even personally say that I know what my moms went through, but out of 14 moms that I started with last year, I have a 65% breastfeeding rate. So 9 out of the 14 continue on to breastfeeding up to 6 months. And today, 5 of them have continued past the 12-month mark. Eventually, I would love for it to be more, but I'll take that 65% rate that was done through video. So not being there physically and still making an impact through video was that shared moment through, you know, we become their auntie. I'm their tia at the end of the day, no longer la enfermera, their nurse. It's more of a family bond. So it's definitely made an impact. So I love that shared responsibility theme. Definitely.
And you really speak to having that family support. And so not everyone has that people in their family who have breastfeeding experience who can give the same support, but there are so much, our profession has really evolved over the years so that we can give support to families. And so you mentioned a couple, the CLC, the IBCLC. For those who may be listening who don't know what that stands for, do you want to explain what that means?
Sure. So the CLC is, well, there are differences. You have the CVS and the CLC. So we all fall under the umbrella of becoming lactation counselors for our moms or anyone within the community that we service. An IBCLC is an international counselor in lactation. And
International Board Certified Lactation Consultant.
Okay. Sorry. This is real. When you get nervous, you forget things. And yeah, I forgot where I was going. Sorry.
So yeah, and so you have this experience in working to even further your professional role, which I think is so important. And you talk about being a Latina and serving your Spanish-speaking community, and which is really important. You know, as a lactation consultant myself and working in the hospital, and my fellow lactation consultants, and we got to know many throughout Northern New Jersey. And they're some of my favorite people, some of the most caring people, so kind, so, you know, just wanting to help. When we're all together, we look around and we're like, you know what, we're mostly white ladies. And that we don't represent the communities that we serve, you know, so that's something that's really been on the minds of so many, you know, and there is such disparities in different populations when it comes to breastfeeding. And so there's weeks, so we have the World Breastfeeding Week, National Breastfeeding Month, and then we also, about 9 years ago, started the Black Breastfeeding Week. And so have you heard much about Black Breastfeeding Week or why that even was started?
To be honest, it wasn't until recently when I saw the flyer for the partnership that we are having, that we're hosting the Breastfeeding Month in August, that I started to look and do a little more research on it. So I can honestly say I was not aware of it, and I looked into it. I do see that there's a history with trauma, but I am so excited to learn more in regards to it. And I'm sure you have a wonderful speaker that's going to be able to provide that education to us.
I'm so glad you asked. You know, actually, one of the founders of Black Breastfeeding Week, who kind of came up with the idea, is Kimberly Ehlers, and she will be speaking. I am so excited and actually a little nervous because she's like the superstar in this world. But she's a journalist to start with, but she's written books specifically about breastfeeding and how the culture, a lot about how it's not just an individual choice, but how the culture and formula companies and how hospital policies and all of these things led to where we are now. And so she helped to found this Black Breastfeeding Week to really give a voice, you know, as I also studied public health. So I love looking at data and stats and, you know, making health promotion programs and all that. But this is a chance for people like myself to just stop and listen. And so often those who, not everyone has the same voice. And so this week is a chance to really listen to those from the Black community about their experiences. And so Kimberly Ehlers has a bunch, she's an author, she has a podcast, the Birthright podcast, and she also has an app that she developed so that women of color can put their own kind of reviews of their experiences during the perinatal care, including lactation. So I'm thrilled that she is going to come and speak to us and talk about what she's learned and from the voices of those who are impacted. So, so we can really learn a lot about how, because I think as, you know, lactation consultants, as nurses, and just in general, we bring biases with us, whether we recognize it or not, it's there. And so she's a great communicator. So I'm really looking forward to having her speak about, you know, what we can learn and how we can do better. And, you know, and that's kind of a general theme. I know that the New Jersey Breastfeeding Coalition has really been focusing on that too. And in fact, this past year, they developed a scholarship to try to increase diversity within the lactation consultant field. And so to giving scholarships to those who come from underrepresented communities. So Charlene, would you like to speak about that at all?
Well, thank you. I'm a little humbled and honored. I was one of the 3 recipients of the scholarship. I am very excited what I will be able to do further along and educate myself to be able to provide that back into my Latino community. It was a surprise, needless to say. I did apply, and knowing just within our own circle, so many other nurses were going for it, and I was actually picked. I was I was really humbled by it. Yes, thank you.
I was so excited to hear. And because to become that IBCLC is really expensive. All the courses and classes and credits and the exam, and it can be prohibitive for many to take that next step. So I'm so glad that there's efforts being put to have better representation amongst our field. And so as a Latina who serves you know, the Spanish-speaking community, what kind of barriers have you seen for that community, for your community to have success in breastfeeding?
Wow. Before I even say, I even go on that is a great question. I do have to say, I do have to thank the partnership that they have been able to provide us with so much education. So they actually took care of the components of the education part for me to actually embark on the IBCLC. So I have to say I've been very blessed in that aspect. But now to bring into my community for my moms, for my Latino moms, it's a lot of the times when they go into the hospital, a lot of us don't know. When we're first-time moms, we don't know what to expect. We don't know what resources we have within the hospital. So the number one thing I always tell my mom, we start speaking about breastfeeding very early on in the topic, and we have to deconstruct, you know, do you want to breastfeed? If you don't want to breastfeed, why? And start learning that we as a Latino community sometimes look at breastfeeding, oh, that was something that was done back then because they didn't have any other means. I've now arrived at the, you know, to the United States, and it's a different lifestyle, and I need to get to work. I don't have the ability of staying home. So who's going to feed my baby? Insurance companies do now cover breast pumps, but not for moms that do not have insurance or are unable to obtain insurance. So they can't get a hold of a breast pump. So how can they actually express their milk when they don't get a proper time frame at work to do it? They're not in the proper work conditions. They're working sometimes 15 to 16 hours. And they don't have the luxury of maybe being home 6 to 8 weeks as we would normally have, because they have to get back to work. So it becomes a very challenging thing to help my moms be able to navigate the system, how to get them the resources that they require, how to let them know what their rights are, how to maybe be able to obtain, even if it's a manual pump, to assist them, how to properly store their breast milk, because they're not quite sure, you know, they think it might be a normal Ziploc bag that they can store their breast milk in, or just simply not having the support. They're here alone. They don't have their mom or their sisters helping them with this new baby, and their husband or their boyfriend might not be able to completely comprehend because they both have to get back to work. So when you inform me that this year's theme is a shared responsibility, this falls right up our alley. We are here to provide that care, that assistance, that education, that promotion for our moms to be able to get what they need. My Latino moms have, you know, like I said, I have 5 that are past a year. 3 of them are working full time, and 1 of them is a full-time student. So it makes me so proud that they have been able to overcome all these obstacles, but there's still so much work that needs to be done.
Right, right. A lot of obstacles. And I know you and I have talked before about that sometimes we'll hear, oh, she's Spanish speaking, and like, oh, then we assume that she's here, but it's not a monolithic culture. If someone speaks Spanish, there's so many different cultures and so many different perspectives that can come in. And I think it's easy for many of us to just make assumptions and to bring in our bias and make that this is her story, and this is why, you know, this is the course this family is going to take. And so we have Kimberly Seals Ehlers coming to speak the last week during Black Breastfeeding Week. The week before, the 19th, we have Brenda Reyes coming to speak, and she is a nurse. She's a lactation counselor. She's based out of Chicago and does a lot of work on promoting peer counselors. And so another way of getting other, you know, support, lactation support from people who look like you, who come from the same culture as you. So I really look forward to hearing her, because she does a lot of work in Chicago and nationally on really helping to decrease the barriers to to the Latino community. So I'm really looking forward to having her come and speak.
You said something so great. The fact that most people assume, well, you speak Spanish, you'll be able to understand each other. There's so many different dialects within the community and within our cultures, that the number one thing, like you said, breaking down barriers, is sometimes just learning, well, what do you do back at home? What is customary for you? I may not know because I come from a different culture. We may speak the same language on paper, but in reality, it's not the same. And just learning, taking the time to learn everyone's background makes that difference. Just providing that little bit of support goes a long way. Letting our moms know that there's a lactation consultant that's available to them at the hospital. You know, it's great to be able to do it by video. It's great once we get out to the world to be able to do those in-person visits, but having someone there those first few hours goes a long way for these moms to be very, very successful in the long run and continuing up to 6 months or more. So just having someone within the hospital that speaks the language and takes the time makes a huge difference. Absolutely. So I'm really excited to hear what Brenda has to say, because she's been doing this, I believe, for over 20 years, correct?
I'm not sure for how long it's been that, but a while. She's been the voice for a lot of people for many years. So she'll be great. So I'm looking forward to that. And just in general, just learning the whole month, we're really focusing a lot on the biases we have when we work with patients, with clients, with families. And, you know, when I think about biases, I often think of, you know, based on, you know, the culture or skin color and think, you know, but one bias I had not thought of is body size. And that is something that you know, we have Kristen Cavutos coming to speak the second week of August, and she is a IBCLC, a lactation consultant from here in New Jersey, as well as a licensed clinical social worker. So she has that perspective of really focusing on mental health. And but she will be presenting about, her title is about unlearning obesity and learning fatness. And to be honest, I was like, fatness, can I say that? Is that being mean? But what she was saying is that, and I can see this myself as nurses, especially in the hospital, when you have so much you have to do and you want to fill in your, you know, your boxes, and just seeing, you know, looking at BMI, okay, check. So now I can make all these assumptions on what about the person, about the risk factors and all of that. And what she has been teaching me is that, you know, is that really based on fact? Is this or is it biases that has been ingrained in us? And while we talk about body size a lot in dieting and, you know, clothes and all, rarely do we talk about the biases that we carry. And it's really remarkable when you look at some of the studies and how people in larger bodies are treated by medical professionals, including during the perinatal period and lactation. And so I think she really brings up a remarkable point, that it's something that we may not be even realizing, the biases that we bring with us when we do interact with families of different sizes, with those who with extra adipose tissue, you know, and not just looking at the clinical factors, but really at the health of the person. So I really look forward to that, because that's something I really haven't been thinking about.
And you're absolutely correct. I mean, we sit there when we're on the floor, and on the floor, we mean when we're in the hospital. It's one of the terms that we tend to use. We have a computer screen right in front of us. And it's, you know, we're asking them, let's say on admission, you know, blah, 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 blah about your history. And we're just checking off these boxes where, you know, as much as we want to give them that one-to-one, we're not looking at the person. We're looking at a screen, and we're going based on that screen. And, you know, oh, well, blood pressure may be high. It's probably because she's overweight or whatever it may be, instead of looking at the person for what they may be. She might be overweight and have better blood pressure than me. But it's just, I guess, what we've learned through the textbook and what we've learned through the computer, trying to unlearn that and looking at the person as an individual. That is great. I don't think I've personally have sat down to kind of dissect that. I did have the privilege to have one mom that was obese. And in the beginning, you know, when she went to go get her pregnancy test, a lot of people told her, well, it might just be that you're overweight. We don't think you're pregnant, because the test came back negative a few times. But in fact, she was pregnant. She wasn't given that sympathy. It was more like, you know, there's no way of telling you're actually expecting. The tests are saying, no, you're not. Like, she was made to feel that just because she wasn't that perfect body size, she couldn't be pregnant. And then moving along, I personally thought, oh, she won't have any problems breastfeeding. I mean, she has, you know, she's been blessed up top, and, you know, she eats very well. She's going to be able to feed baby without an issue. And it wasn't until I started reading a few more books where it states that there might be an issue. Thank God she didn't. She now has 3 healthy babies, and she's breastfed past 12 months, her 2 eldest, and her baby is still breastfeeding right now. So she is a success story. But when I read the books, it made me look back and think, oh my God, I thought otherwise. I thought she was going to be able to feed without an issue, but I guess not everyone sees it that way.
Right, right. And just even making assumptions about who the person is, just, you know, by body size is something that we all need to be aware of and to think about, and how it's impacting our care. So that's going to be great. I really look forward to that. And, you know, as we're evolving and we're learning, and, you know, our language is changing as we're learning just how to give respectful care. And I think one area where our language has changed a lot, where we're learning to adapt, is with the LGBTQ plus community.
Yes.
And so we, you know, just learning to ask for pronouns and to be comfortable with that is something that we're still, a lot of us are still in the process of learning the best way to communicate and how to be respectful. And so we have, starting off next, a week from today, we have Mystique Hargrove coming. And so I'm really excited about her. If you've seen her in our flyers, her pronouns are she and they, so she'll interchange between them. And so they are a full spectrum doula, worked with mental health, with postpartum. They're a lactation counselor, but also just does a lot of training for professionals to learn how to update their language, and how, and it's really, in some ways, it can be challenging for us to learn that what we've been saying and how we've been interacting with families could have been harmful or could have been disrespectful. And it's a hard thing to get used to, but I think it's really important. And so I'm really looking forward to the talk and really learning more, and how I can be better and how we can be better.
Absolutely. And I must say, I cheated just a little bit. Her name just kind of made me feel like I need to go take a look. And I peeked at the Facebook. Bless you. Sorry, I do have children roaming around the home and they both have allergies. I did take a peek at the Facebook, and very mystical. She definitely took me to a more holistic view and approach, and I'm really excited. I'm excited about all of our speakers, but there was just something about the aura and just very mystical. So I'm excited.
Yeah, me too. I'm really looking forward to it. And I think there's just something that we can all learn, you know, with the theme of a shared responsibility. It's our responsibility to make sure we're encompassing everyone, providing services to everyone the best we can. And really, you know, lifting up the voices of those who are doing the work. And for Black Breastfeeding Week, we have our program involved with the partnership. The Sisters Who Breastfeed will have a few events going on. So we'll hear more about that, and just ways that we can listen and learn is something that I really want to improve on myself too.
Yes, Melanie is wonderful. I actually had the pleasure of having a bit of a conversation with her yesterday, and she has so much knowledge. She's so personable. We were speaking about one of the videos that she did last year for the partnership to basically show how much our breasts can actually produce and how to actually feed, and how the fat will eventually come up if it's in a bottle. Just kind of demonstrating just all the different ways that we can picture, because sometimes we can't really see. We can't see what's coming out of our breast. We can't see how much baby is being fed when they're being fed from the breast. But when you actually, she put it in a glass, and it was very educational. And she did it with so much personability and very quickly and just to the point and in language that's so understandable. So she's amazing. She's been doing it for a very, very long time. And she has also, I believe, breastfed all three of her children. So she comes with not only personal, but educated background.
Yeah.
Sorry.
This is Melanie from the Sisters Who Breastfeed program.
Yes.
Yeah.
Yes. Yes.
Yeah, it's great. And, you know, I just want to even kind of talk about the point that as we talk about breastfeeding promotion, that just to make sure that it's not taken as breastfeeding coercion. You know, I think that sometimes that gets confused, that what we should be doing is giving all the knowledge, like you were saying Melanie was doing, just putting it in a language that's understandable. Because if a family decides that it makes decision how long they feed their baby, they need to make an informed decision. And so it's our role to give information in a way and work with the community to make sure everyone has a shared responsibility to make sure the community is well educated so they can make an informed decision. And if for any reason that they do not breastfeed, whether it's a personal choice or whatever the reason is, that they're absolutely supported in feeding their baby in the safest way possible. And so giving that information. So it's really breaking down the barriers and giving the support and protection that our communities need to meet their goals for feeding their baby safely.
Yes, absolutely.
Yeah.
Just, you said it. The shared responsibility. I don't think there could have been a better topic, or a better theme for this month than shared responsibility. We're not in this alone. We've always heard, and it could have been from our grandparents, our great-grandparents, it takes a community, it takes a village.
Yes.
So definitely not being alone during this process, if you choose to breastfeed or if you don't, why? Just understanding why. And it's not to judge, it's not to just, oh well, you should because you have to and it's better. Just, hey, this is the information. What can I help you with? How can I help you succeed? And if it doesn't work out, then it's okay. You gave it your best. You shouldn't beat yourself up. And I think as moms, we tend to do that a lot and you said it in the beginning, when we feel we're not succeeding, or we have those days that we're crying because nothing's working. Baby might be on that growth spur where they just want to eat a lot. And we don't understand it. We just think, I'm not producing enough. I'm not getting enough sleep. You're not alone. We are here to support you. And that is basically what we're trying to get out there. You're not alone.
Yeah, absolutely. So there's whether it's your own family and friend network, whether it's getting a support group. You know, I worked with a support group during the pandemic, and it was all virtual, but they really bonded, and these new parents just helped each other to get through some of the most challenging times to be a new parent. And the partnership has support groups for new parents. And it's out there if you don't have it in your immediate circle. So just making sure that we get that message out, that you have support. And, you know, even just for some mothers that they pump and they don't breastfeed, that's breastfeeding. If you're combining, however, you can find what works for you, and that you have that support and know that you are helping to be the best parent that you can be. So it makes me really proud to be with the partnership, to have this awesome, you know, the speaker series next month, to have really incredible nationally known speakers come and talk, and I just in having all the programs at the partnership.
Absolutely. And before, just so we can remember for ourselves, as we're learning this new lingo, we also have chest feeding. So for those that may not be able to breastfeed, there is chest feeding. So again, I know we're going to learn a lot more on how to better express ourselves, to be more inclusive. So I'm really excited, definitely excited on how we will share this responsibility as a whole.
We will. So a lot of these programs, the Nurse Family Partnership, the Sisters Who Breastfeed, the support groups, they can be found on the website, www.pmch.org. And also under the Professional Education tab, there is all the information about the speakers who will be coming in the next month and how to register for that. So I hope a lot of people will be joining us. And yeah, I'm really looking forward to it. So thank you so much, Charlene, for coming and speaking with me today.
Thank you.
And I look forward to your continued journey to becoming a lactation consultant. And I'm grateful for everyone who's joined us today, and hopefully we can do this again.
Yes, absolutely. Thank you so much for having me. And if anyone is interested in learning more about the Nurse Family Partnership through the Partnership of Maternal Child Health, we will put a link below. And like I said, we don't only service New Jersey, we are across the nation. So you'll be able to put your zip code and it just pops up in your area that might have a close one to you. And we have our central intake that would be able to connect you with someone. So thank you so much for having me this afternoon. I'm truly excited for what awaits us next month.
Yes, you too. Well, happy World Breastfeeding Week and National Breastfeeding Month.
As well, Sarah. Thank you, everyone.
Take care.